Have you had pelvic radiation for cancer treatment and are slowly developing progressive stiffness of the hip and or low back, and maybe even you're starting to get pain? If so, you're going to want to stick around. Hi there, my name is Beth Hoag. I'm a physical therapist with over 15 years of experience working in cancer rehabilitation, lymphedema, and pelvic health. I'm also the founder of the online cancer rehab space. In this video, we're going to talk about hip and low back stiffness following radiation therapy of the pelvis. What you might notice, why it happens, and what you can do today to start feeling better. So let's get started. First, let's talk about the types of radiation therapy for pelvic cancers. There are two main types: internal beam and external beam radiation. External beam radiation is when radiation as therapy is delivered from a machine outside the body that typically moves around the body as you stay still in a specific position. Internal beam radiation is when radiation is delivered from the inside of the body. There are different ways this can be done, but in the case of pelvic cancers, the two most common types are seeds or pellets, and second, an internal rod or beam, usually through the rectum or the vagina. You may have one type of radiation or the other, or you may have a combination of both depending on your individual situation. Now, the reason this matters is because each type of radiation therapy has its own specific type of side effects, both short-term and long-term. Now, in the case of hip and low back stiffness and possibly pain, the most common time this happens is with external beam radiation. Now, hold on a second. If you've only had internal beam radiation, I want you to stick around, because even though I said it's most common in external beam radiation, it can still happen with internal beam or brachytherapy. Now, I also want to take a quick pause before we move on and talk very briefly about the side effects of radiation therapy. In my experience working in cancer rehab, people are very well aware and expect the short-term side effects, namely those skin and tissue irritation side effects that happen with any type of radiation therapy. For example, redness, heat, swelling, mild chafing, and even in some cases more significant blistering. People seem extremely well prepared for these types of side effects, but these aren't the ones that we're really talking about and dealing with today. We're talking about those longer term side effects that often start to show up weeks, if not months, after radiation therapy is complete. This, in my experience, the vast majority of people are not well prepared for, or actually have no idea this is even a possibility. In the case of pelvic radiation therapy, like we're talking about in this video, hip stiffness and low back stiffness and pain really can catch people off guard. These side effects are rarely discussed, and they come on slowly and gradually. Often for some people, I've seen that they're no longer being followed by their radiation oncologist, they're being followed by somebody else, and so this is often missed, and people live with this for a long time, and it has a significant impact on your quality of life. So let's get to the meat of this video, which is why I know you're watching. This gradual and progressive tightness in the hips, low back, that can even eventually lead to pain. So I've already sort of described it, but what exactly can you expect? As I mentioned earlier, typically a few things. One, this usually shows up months after radiation is complete, sometimes even 4 to 12 months after the end of radiation. Two, people often describe to me that things are getting gradually stiffer. They're having trouble moving their hip and their low back. And what usually people specifically start to notice is function, how those range of motion limitations start to impact their function. For example, I commonly hear people say they're having difficulty crossing their legs when they're sitting. They're having difficulty reaching for their socks or tying their shoes or putting on their shoes. Eventually, over time, these stiffness issues start to produce pain. So some people often start to notice that as well. The upsetting thing with pain, after you've had a cancer diagnosis, I probably don't have to tell you, can be extremely distressing. The moment people start to feel pain, especially if it's near the area of their original cancer, is rightly so. People start to get concerned and to stress this might be the cancer coming back. So before we move any farther, I certainly want to encourage you, as with any of my videos and information, if you're experiencing something new or out of the ordinary, I really do encourage you to speak to your doctor or your medical provider so that they can rule out any other reasons why these symptoms might be happening. Often by the time people end up coming to see me, they absolutely have been dealing with this for quite a long time, and it didn't really occur to them at all that this could be related to their pelvic radiation. So in other words, people really have been suffering for months, rarely, but sometimes even years, before the light goes off that this could be related. If they have been to a medical provider, it is not uncommon that I hear clients tell me that they've been told that this is your new normal, that you just have to get used to it, and that this is just the reality after radiation. Look, we can't fully change what's happened from radiation therapy. We can't undo all the side effects, but we absolutely and very likely can improve this with some simple strategies. So why exactly does this stiffness in the hip and the low back happen? Well, we know that tissue healing after radiation continues for months, if not years. Long after the skin and tissue irritation is gone, tissue healing continues. The body takes months, if not years, to heal from radiation. And this is the part that nobody seems to be talking about. If you're interested a little bit more about this constant healing that goes on for months, I'm going to put a link in the description box below to a video I did about radiation fibrosis. Essentially, connective tissues and muscles, anything that was within that radiation field, progressively gets tighter and more restricted over time. As a result, this most commonly starts to gradually pull on the hips and or low back, and over time, this can even start to cause pain in that region, and sometimes you can start to refer down the leg. So now that you understand a little bit more about pelvic radiation and why it can cause hip and low back stiffness and pain, I want to spend the last little part of this video going over 3 things that you can do to start improving that today. Let's dive in. So now let's talk about 3 things that you can start doing today to feel better. The first is what I call movement snacks. As humans, our bodies are really designed for movement, but the reality is we all spend a lot of day sitting in relatively sedentary positions. Whether you're in a desk job and you're back at work, or perhaps even you're still recovering from your treatment, a lot of us spend time sitting. This is where movement snacks come in. When we're feeling stiff in the hips and low back after radiation, this lack of activity can make things feel worse. I know this is a bit ironic because it's a vicious cycle. When we feel stiff and uncomfortable, we tend not to move, and we move less, we tend to feel more stiff and uncomfortable. So at some point we need to find a way to break this cycle, and movement snacks is a great way to do this. What I mean by this is small bite-sized movements multiple times throughout the day. So even once every half an hour to hour to get up and do some simple movements for the hip and the low back. This is easy to forget. We often get going with our days and don't remember to do this. So what I commonly suggest to people to do is to set an alarm on your phone, or if you're working at a desk, put it on your computer. Have something that jumps out and reminds you to get up and move. Now, these movement snacks don't have to be complicated, and they don't need to last for long. So this can be 1 to 2 minutes of something very simple to get you out of that position, whether it's sitting or lying, and get you moving your body. So simple things like just the act of standing up and marching on the spot to get that body moving. Or it can be getting up and going for a walk to the water cooler to get a cup of coffee, maybe even just to go to the bathroom. These things don't need to be complicated, they just need to happen frequently. Think about our body a bit like a car, and now think about the oil in a car. At the beginning, when the car is cold, the oil isn't lubricating and moving well around the engine. But as we get moving, that oil warms up and it does a better job at lubricating the car. Same thing with our bodies. When we're not moving, the fluid we have in our joints called synovial fluid is colder, and it doesn't do quite as good a job of moving. As we get moving, it helps to warm that fluid up and also get it moving around the joint to do a better job at helping us feel more mobile and limber. The second tip is daily purposeful exercise. We all need to be moving more. There is no way around it. We need to be making purposeful exercise a priority in our lives. We should all be aiming to reach a minimum of 150 minutes a week of moderate intensity cardiovascular exercise in our lives. From heart health to bone health, to risk reduction of cancer recurrence, to lymphedema risk reduction, to increasing your cancer treatment tolerance. These are all reasons why we need to be making purposeful exercise a priority in our lives. I know this isn't easy, but in the case of hip and low back stiffness, this is even more important. Getting back to that concept of motion is lotion, movement is going to help the low back and the hips feel better. Now again, I know I've talked about this concept, it's a vicious cycle. If we're stiff, we don't want to move, and if we don't move, we start to get stiff. So the key is to pick movement or exercise that works for your body, as well as I'd encourage you to consider an exercise or a movement that you enjoy doing. If I tell everybody in this video to go out and walk for half an hour a day and you hate walking, you're not going to do it. So the key is to pick something that you're going to at least slightly enjoy. So this can be anything. It can be simple walks. It can be going for a bike ride or getting on your stationary bike. If you enjoy the water, getting in the water is a fabulous way to exercise and get moving for the hips and low back, but also take some of the load off of those joints, which can make movement feel easier. Even getting together with a friend or a loved one, that can be a great motivator to get you moving. But at the end of the day, there's no way around it. We all need to be working towards more purposeful exercise, aiming for 150 minutes a week. And the final tip I have for you is specific stretching for the hip and the low back. Typically, I recommend holding these stretches for 1 to 2 minutes and repeating them once to twice a day. At the beginning, you'll probably find it helpful to be doing this once to twice a day, but as you start to become more limber, you might find that every other day, 2 to 3 times a week, is enough to maintain the flexibility that you gain over time. Now, ideally, it's best to do your stretching after you've done some purposeful movement or exercise. This gives a chance for the muscles to warm up, and it makes your stretching more effective. Finally, when you're doing your stretches, I want to encourage you not to force. You should feel pulling, but never an increase of pain during or after you perform your exercises. As well, taking deep breaths and slowing down really invites the body to create space as opposed to forcing. It is impossible to force a stretch and actually let those muscles go. So not forcing the body and meeting yourself where you're at to get a moderate to strong pull without any change in your pain levels. If you're curious about learning some specific stretches and want some more guidance, I've created another video for that, and once it's released, I'll put it in the description box below. So I hope you found this video helpful. If you enjoyed this content and would like to see more, I'd encourage you to give us a big thumbs up and subscribe to my YouTube channel, which is completely free. Finally, the best gift of all you can give is to share this video with someone that you think could use this information today. Because at the end of the day, your quality of life matters. It really matters. Until next time, be well.